Good afternoon, everyone. Welcome to our CEO Desktop Chat. Thank you for joining, and we welcome the opportunity to field your questions about many of the things we have going on now within the organization as we transition through our COVID preparation activities and begin moving on to restoration and other things that are taking place. We know there are still lots of questions about what that looks like, so please make sure to submit your questions from the bottom of the screen, and we will answer those questions at the end of the remarks from our CEO, Delvecchio Finley. Before we turn it over to him, we would like to have our panelists introduce themselves. I'll start with myself. I am Terry Lightfoot, Director of Public Affairs and Community Engagement here for Alameda Health System.
I'll introduce myself next. Hi, I'm Felicia Tornabeni, the Associate Chief Medical Officer, and coming to you live from the San Leandro Hospital drive-through testing site.
I'm Janet McInnes, the CNE CAO.
Okay. Delvecchio, we'll turn it over to you.
It looks like Dr. Hussein is signing on as well.
Okay.
So we'll welcome him when he is on, or if you're on, Tedvir can hear us, you can introduce yourself as well. Okay. All right. Well, we'll welcome him when he gets on. Thank you, Terry, and thank you to everyone else, and good afternoon. And welcome to our the first of our post Command Center weekly desktop chats. As we had mentioned, we will keep these going. We found them to be a useful means of staying in touch with you, hearing some of your wonderful thoughts and ideas, and finding a way to make sure that one other mechanism to make sure that your concerns and your issues are being addressed in a timely fashion and in a robust fashion. I want to start with acknowledging an important week every year for us is Hospital Week, and that is this week. And words can't express how appreciative I am for the phenomenal work each of you have done and are doing to allow us to continue to provide care to our community. We serve some of the most vulnerable populations in Alameda County, and it is vital that we continue to be able to operate and to be here for our community when they needed us the most. You made that work possible, and for that, I thank you. If you haven't seen it already, I highly encourage you to visit our intranet and to look at the short video that was made to salute all of you, each our healthcare heroes and frontline workers, each and every one of you. Now, one of my favorite parts of this gathering is the shout out time. So I have 4 shout outs that I want to do this morning quickly, or this afternoon. Let's start with the STAR team. So many of you know the STAR team that's led by Sylvia Lozano. They help us with a lot of our efforts, key efforts for the organization, whether it's lean, performance improvement work, project management work and support, and a host of other activities. This team has been wonderful to work with and to engage with always, but especially during this time of our pandemic and the response and preparation efforts for COVID-19. They will continue to have a very integral support role, particularly for our procedural and operative or perioperative areas as we look to restore and resume certain services that were curtailed in preparation for our response, our pandemic response. I also want to give a shout out, raising the roof for our chaplains, all of our chaplains who support our patients and support us and our colleagues, with a special shout out to Reverend Sue Magidson and Betty Clark for their agility and unwavering support for our caregivers. They recently created a pandemic approved virtual version of the annual Blessing of the Hands that they extend each year during Nurses Week. I believe it's been posted, or if not, it will be posted shortly. And please be on the lookout for this video. I had a chance to see it yesterday, and it truly lifted my spirits, and I know it can do the same for you. I also want to give a shout out to our other local first responders and military comrades, I'll say. Many of you, I hope, were able to experience either live or via video postings one of the many displays of support that we've seen from members of the community, whether in the Bay Area or statewide. Just really amazing outpouring of support from police departments, fire departments throughout the Bay Area, paramedic services, a host of others. This morning, many of you maybe even saw a flyover from the California military force, and that was really, really nice to see. So that's my last one. I really want to thank every one of you for sending your shout outs. Please continue to do that. We'll try to acknowledge everybody that we can. This is really more for us to thank you and to continue to acknowledge everything you're doing to support our organization and to support our community. So I want to turn and share a little bit about the Incident Command Center. As Terry mentioned, the Incident Command Center's last day of operations was last Friday, but our work continues, just in a different form. We've shifted our focus now to efforts that are centered on restoration and recovery with a continued situational monitoring, awareness, and preparedness. That's important to say. But I do want to pause and thank all of the people who helped to staff and support the Incident Command Center. As you know, the Command Center went full-time staffed in early March. So for several weeks, people were here 24/7, then 12/7, then 12/6, and gradually ramping down as we were able to really fully formalize our surge preparedness plan, get a lot of testing and training in place, and a lot of elements of the plan actually implemented. So I really want to thank all of you for everything that you were able to do. I know that it was arduous and very important work, and that helped us to address all of the challenges that this unprecedented COVID-19 pandemic challenge has sent to us and sent our way. So we know that COVID-19 has not gone away, and as we move towards restoring services that we postponed, we have to remain vigilant. Should the need arise, we have processes in place to react to and to reactivate the command center. Communication will continue to flow via our memos and this desktop chat. The resource page, the coronavirus resource page that we have on the internet, will continue to be monitored, and our supply dashboard will continue to be updated every Wednesday. And with respect to restoration of services, during the pandemic, we postponed certain elective procedures to increase the safety for our patients and our staff and to be prepared for any impending surge. We're now formalizing our process and our plan to guide restoration of services and as quickly and as safely as we can. The restoration process will be guided by learnings developed during our COVID-19 response and will include a plan with clearly standardized process and steps to ensure alignment across our system. Now, having this systemic approach is important as we ramp up operative, procedural, and diagnostic services and remain ready to respond to the ongoing presence and potential surge of COVID-19 cases in our community. To move the restoration and recovery phase forward, AHS has established an Oversight Committee that will provide guidance and coordination across our system. Some of the key factors that will inform our efforts include patient and employee safety, our ability to track and respond to the surge, equity, efficiency, as well as our fiscal and resource constraints in the organization. The process will engage medical and technical experts, as well as support services leaders, to determine the restoration of the right proportion of services within the appropriate time frame. The last thing I want to mention before I pause and turn it over for our questions is developments that we've made in the testing front. So as you know, our shelter-in-place orders are still in effect and have been extended through May 31st, 2020 by the Bay Area health officers and the state of California. Ensuring that the state has sufficient capacity to test for COVID-19 and this ability to do so is a key indicator in our state's efforts to modify our shelter-in-place orders. AHS has been supporting testing efforts in various ways, and we continue to do that as we move forward. One of the ways we're particularly proud of, and want to give a shout out to that group, our Healthcare for the Homeless team has been providing testing at our Operation Comfort locations, the county's Operation Comfort locations, and is partnering with the county to find new ways and locations to support even more testing. Also, after careful consideration and hot off the press, our San Leandro Hospital location was designated as our system-wide drive-up, walk-up testing site. And I'm happy to say today we began testing symptomatic ambulatory patients receiving care within our system. And in just a moment, I'll turn you over to a live feed from Dr. Tornabene to share some updates in that space. But before I do that, I want to say one last thing, and that is that we will also be looking at using this site to support testing associated with resuming or increasing services and for other high priority or high risk individuals. And with that, I want to turn it over to Dr. Tornabene to share the exciting news and really to highlight the wonderful work that she and others have been leading over at our San Leandro site. Felicia?
Great. Thanks, Delvecchio. Yeah, it's been a great day. In order to stand up this testing site, I can't underscore the teamwork that has gone into doing this. I mean, it's literally almost every single department and discipline has come together across the system in order to stand up this site here. So indeed, we did go live. Technically, our hours for drive up or walk-in testing are 10 to 2 every day. However, we did have our first patient this morning who had an order from the ambulatory setting and who walked up at around 9:30, 9:35, and we got that patient registered and swabbed and tested. You can see in the background, I'm just going to give us a little bit of a walkthrough so you can see that behind me is our actual nurse testing site. You see Dr. Ng back there, as well as Leanda, who's our nurse today, with some specimens. And then also we have Leticia, who is coming right through there, who's our registration eligibility clerk today, and then also Dr. Gupta, who has been on site all morning. Dr. Baden was also here earlier. And so we're excited that today we are live, but we've only had 3 patients and we are open and ready for more. So we can't wait to, as the word gets out to our providers, physicians, APPs in our ambulatory setting, to get those orders in on symptomatic patients. And then, as Delvecchio, you already said, that we will be following on in the next week or two, expanded testing capacity and populations for other patients that we serve. So we're excited and ready for more.
All right. Well, thank you for that live news update. I was going to call you
Terry,
but nobody might remember who you are. Yes,
I'm
sir.
sorry. So first, let me just say congratulations and a really special thanks, Felicia, to you and
Sure.
Valerie and Rachel and Neha and Lawanda and everyone there. All of our folks were really standing that up. It was an incredible effort and excited to see that it's going today. So I just had a visitor come by, one of our trustees, Trustee Ross
Excellent.
Peterson.
Hi, how are you?
So Trustee Peterson, you can see we have over almost 430 folks on the line
Wow.
today, and these are our leaders. We do this weekly, and we give an update of everything that we're doing. And so I just thought it'd be wonderful for you to say hi to them. And anything you want to say on the fly, or you just want to say hi?
I've been visiting some of the hospitals. I've been in almost all of the emergency rooms over the last 2 weeks, and also I visited Highland, the 6th and 7th floor, and I've been at John George and also Alameda in the telemetry unit. And you guys are just doing a wonderful job, and I'm proud to be associated with you. And I thank you for your wonderful work.
Well, thank you, Trustee Peterson. We appreciate always your support and encouragement and all the work you're doing in our community as well. So they're out at San Leandro. We just started it up this morning. They've already had their first couple of patients, and we got to keep it going. So you'll hear more about this later,
Great.
but just wanted to see if you could say hi to us.
Okay. Anyway, you guys have a wonderful day and keep up the good work. And
All right.
I'm proud to be associated with you. Thank you.
Thank you. Thank you, Ross. All right, Felicia, again, congratulations. And Terry, we'll throw it back to you for our Q&As.
All right. Thank you. That's what happens when you do live media broadcasts. You have to be on your toes. You never know what's going to happen next. But it was great to have Trustee Peterson chime in. I just have to thank him because he's been involved in a number of our meetings with elected officials and others. He's been really supportive of that. So he's been joining us on a lot of Zoom calls lately. So Felicia, I wanted to sort of continue the conversation because I think there are questions about sort of how the testing at San Leandro Hospital will grow, what employees can expect in terms of employee testing, so that they kind of understand where we are now versus where we ultimately may end up with expanded capacity to do testing. So in terms of employees, are we testing employees right now? And if not, do we have a sense of when that might actually be the case?
So we are actually testing employees right now already. We put that process into place at the end of March. That's been overseen by employee health, so Terry Dixon and then Dr. Ghosh. We have a process where any staff member can reach out to employee health who is symptomatic or has had a high risk exposure and can get tested that way. We will we welcome AHS staff to be tested in that way, and we can send out an updated communication saying, you know, because staff can either choose to go with their PCP, but we also welcome them here at AHS through our employee health process.
Great, thank you for those remarks. As we're moving toward restoration, Del Vecchio, we didn't mention a particular time frame, but can you talk a little bit about sort of what's going to create the cadence for how we move forward and reinitiate certain services?
Gladly, Terry. Yeah, so we are being very careful not to place artificial times on restoring services. We really do want to calibrate between when we are ready to safely, well, we're guided first by the needs of our patients, and what we'd like to avoid is our patients' conditions exacerbating to the point that they're what may start as elective or in some other way kind of a scheduled procedure become an emergent procedure. So we're working carefully to kind of calibrate that and our ability to do that, and that is that balance of time and safety. So the process that we've started, and we have a great group of leaders that are in various disciplines, whether again the perioperative areas, some of the diagnostic and imaging areas, in outpatient, many of the procedure areas like GI and urology and GYN and a couple of dental and a couple of other places are really leaning to those subject matter experts to tell us, what do you think is the safest way and the most time sensitive way to be able to bring services back? And do you suggest that we start at 25% of our usual capacity, 40%, 50%, and we'll calibrate that with how much, you know, reliable staffing we have, PPE we have, our ability to do testing when that's warranted from a pre-procedure or pre-operative basis, and a host of other considerations. We are hopeful because many people, while we just formalized the effort, have been thinking about this for a few weeks as it's been moving throughout our market. And so some of them may be as soon as next week, but we're having every group do their work and then bring it to the Oversight Committee, and we'll calibrate that against, again, system-wide considerations and imperatives, and then work and alongside that group to gradually work with our patients and our staff to bring those services back on. So it could be anywhere from as early as next week to, you know, several weeks out, but we'll be graduating it and calibrating it using all of those factors.
Great, thank you. I seem to have lost my mute button. Can you hear me okay?
Yes.
Okay, good. All right, thank you. Dr. Tony Bene, so when you go live and you do these things, you know, you attract a lot of attention. So we have some more testing questions.
Oh, sure, no problem.
All right. So, and I think this is a point of clarification, but the question is, how would the community know about the testing opportunity at San Leandro? And I think maybe there's some clarification needed about how we're actually bringing folks into the testing site versus throwing it up to the entire community. So maybe you can talk a little bit about what the process is.
Yeah, I can. I'm happy to do so. So for the patients that are referred here for this initial population, those patients have been, quote, seen. It's typically a telephone visit in our ambulatory setting. So a patient might call in because that patient is having a cough or doesn't feel well, and then they route through our ambulatory call center. The call center sets up a phone visit with one of our providers, and that provider assesses the patient in that visit and then would then order an RT-PCR test, the nasal swab for COVID-19. So that's how they're routing in initially here. We are not yet offering any patient can just drive up, because we do require registration in our system and an order, and the order has to have come from a provider prior to the patient driving up.
And are those patients those who are within our system, generally
Yes.
speaking? Okay,
Yes.
great. All right, excellent. Del Vecchio, there's been a lot of conversations recently. I know you were on a interview yesterday with the California Hospital Association about kind of the financial situations for hospitals across the state of California. So there's a question about, you know, what's our financial situation, but I thought this might be a good opportunity to also talk more broadly about some of the conversations that are being had about the need to support hospitals moving forward based upon sort of the expenditures they've made in preparation for COVID-19, and also the ability for us to be prepared to provide services moving forward. So when we look at that big picture, can you give us sort of a sense of, you know, where things are both globally and then maybe locally as well?
Yeah, Terry, thank you. And thank you for whoever posed the question. We'll be able to say, and I certainly look forward in subsequent meetings at providing increasingly refined data around this specific matter of our finance. But let me speak somewhat globally with a couple of topical points. So, as you know, we as an organization had a bit of a challenging budget. I'm being nice there. We had a challenging budgeting period for this current fiscal year. Many will recall, with collaboration with our board and the Board of Supervisors and other stakeholders, we were able to forecast and produce a budget that allowed us to both meet our ongoing cost needs, but also to support a lot of the capital needs that we have as an organization. For example, with Epic or Sapphire for the organization, our rehab relocation that just seems like it was so long ago, it was just December. The ongoing work to support the seismic work out at Alameda Hospital, and a host of other needs around equipment and supplies, our foundation being a big partner with that as well. Some of you may have even seen the recent update about a mammo unit that we were able to bring over to San Leandro Hospital to support care delivery there as well. So a lot of things that we were able to do, but you know, very, very challenging financial circumstances with respect to supplemental availability of supplemental dollars and shifting sort of demands there, and how we get reimbursed, and a host of other challenges that we perennially face. Those have been compounded, to put it directly, by this pandemic, both from the perspective of costs that we've incurred with respect to responding to the pandemic. So the increased costs related to PPE that our wonderful purchasing team and our supply chain management staff and team have been excellent at ensuring that we have to protect our staff, but we quite honestly had to spend a lot more as there has been a surge in a demand, a spike in demand and a drop in capacity for those things around the market. The requirement to keep our staff as active as possible to be prepared for the response, various benefits that we've been able to extend to help people support themselves and their families through all of this, compounded with the loss and the reduction in services, the drops in utilization of our emergency rooms, the shifts in our clinic utilization. I should also add the amazing work that our IT team did along with our ambulatory providers and staff to shift as many of our clinic visits and others to a virtual basis, and supporting our patients that way too. So a lot of costs expended, a lot of revenue lost as we cut back on certain services, experience less utilization within our system as we appropriately prepare for the response. I think right now we have a finance committee meeting tomorrow, and if my memory serves me correctly, our CFO has forecasted that on an actual basis, we have lost probably north of, on collective, we've fallen short north of $20+ million. And forecast when this is all said and done, depending on, again, how long it goes, could be even double that. We have fortunately been able to secure some additional relief from the various federal funds primarily that have come forward. So right now, I think we've achieved about $14 million. Our foundation has raised several $100,000. We are trying on both of those fronts to secure more. We are applying for and monitoring a lot of different funding sources that are out there to help organizations like ours who are experiencing these challenges. And so it remains to be seen what the full-on impact will be, but we want to make sure everybody understands we're doing everything we can to ensure both that we can provide or secure the resources we can to meet the costs that we continue to incur as an organization, but also to be able to support our infrastructure and our organization moving forward. As particularly many of you may have heard, there's forecast of what is being referred to as a second wave. And so while our first wave, depending on where you believe we are, looking at the different forecasting tools, has definitely outperformed the potential risks that we had during this time period of a significant spike. And that's great for our community. It's great for our families and our loved ones. We still have to remain vigilant, and we need our workforce, we need our capabilities to be able to support our community through all of this. So we'll be continuing to work with our board and with the Board of Supervisors and other stakeholders to see how well we can continue to secure resources. I don't know. I certainly want to clarify that it is our hope that we can avoid a lot of the measures of austerity that, quite frankly, some organizations have already started in terms of either furloughs or reductions in workforce or any of that stuff. We are really working diligently to try to avoid any of that that's COVID-19 related and preventable as preventable as it can be. But we'll be sharing more, and I'll be as upfront and as timely with that communication as I can, so that we can work together as much as possible to support one another. Sorry, that was very long-winded, but I wanted to make sure I got all those points in.
Great, thank you, Del Vecchio. And just to, if you can, outside of sort of our specific sort of budgetary challenges, what are we doing collectively as sort of healthcare providers associations to try to ramp up or shore up our ability to provide services moving forward? There's a term that floats around, a lot of folks are using post-COVID-19. I think maybe post may be a little optimistic. I don't know if it'll ever necessarily go away. So there's going to need to not just sort of re-ramp up services, but also be prepared to continue to manage COVID-19. So that's going to be an ongoing drain on resources. So how are we working with our legislature and others to make sure, or at least look at ways in which we can be sustainable as we open up new services, but still maintain that responsive nature to this pandemic?
Yeah, thank you, Terry. It's ironic. I will share some of this stuff, much of which you could share, because it's the work that you and your amazing team are doing, but you're serving as moderator now, so I'll share the details. We are, one of the biggest points that we are underscoring both at the state level and the state level and the federal level is that COVID-19 has impacted all elements of our economy, not just the healthcare sector, as it were, but other areas of industry, many of which are really looking forward to coming back to some level of new norm, whatever that is. And one of the things we underscore is the ability to sustainably do that really relies on having a very responsive and prepared healthcare delivery system, so that if that second wave comes, we're not talking post-COVID at any stage at this point, where a vaccine seems to be very far away, and naturally so. We certainly hope it comes sooner, but until that occurs, we're in a different transitional state, or a different phase in the transition. We're not in a post-COVID environment. So we really want to say that it's important that we shore up and support the healthcare delivery system. We're doing our own advocacy with a lot of our local and state and federal representatives through our PACE team. We've been having a lot of Zoom conferences with those leaders directly and their staffs, even more so with the leaders, and we sometimes normally have routine access to them, and that's been really wonderful. They've been very proactive, actually, too, in their outreach to us to say, what do you need? How how can we help? And that's been very welcome too. We are working with our advocacy organizations with the California Association of Public Hospitals and Health Systems, America's Essential Hospitals at the federal level, the American Hospital Association, and the California Hospital Association, and a host of other entities who are really helping to lead the charge to make sure that the case is made that the importance of the healthcare workforce has never been more than it is today. And we have risen to the occasion. We've responded to this need in our community. And it's important that the community continues to resource us and support us to be able to continue to support them. So very symbiotic. And those are a lot of the efforts we've been doing. As you mentioned, we've been doing a couple of press conferences, including yesterday, as well as in a national podcast. And we may be sharing more around that to really underscore what's happening in our own community, our effort to support a very diverse community, both racially, ethnically, and socioeconomically, and how important we want to make sure that is both recognized in terms of the impact that this has had on the community and the impact that any restoration or continuation of services might have if we're not mindful of the unintended consequences that happen to disproportionately disadvantaged communities.
Right. Thank you, Delvecchio. Janet and Felicia, this one I'll pose to you, and it's a question about the admitting criteria. So the question is, what is the admitting criteria for a patient under investigations, and what symptoms should prompt a physician to send someone home and self-quarantine versus hospital admission?
I think that the answer to that is going to be a little bit individualized based on the patient in front of you. However, the symptoms that you admit for COVID are not necessarily different than, or the stability of a patient with COVID is certainly of concern when you're seeing that patient in the emergency room and making the decision to admit. However, if the patient has any sign of instability, has hypoxia that is not resolving and requires oxygen, if there's any concern about imminent worsening from a respiratory standpoint where that patient has risk of needing to move to the ICU overnight, all of those are reasons to keep the patient in the hospital. And it's really the lower risk patients that are lower acuity that our emergency departments are sending home. And then it was even just yesterday that Dr. Simon we were in an email exchange about how do we make sure that our patients that we're sending home from the emergency department are bridged back to their primary care in case that they're potentially higher risk. So that certainly is on our mind. And I know that we have seen that patients who present with COVID and who have hypoxia admission, that we have seen some of those patients rapidly decline overnight and they end up in our intensive care units. Those are all good reasons for admission, but there is an acuity at the time of the initial assessment in the emergency department that really determines the need for admission.
Great.
I think the only thing I would add to that is if when a patient comes in as a PUI and they're sent home, they're given explicit discharge instructions of when to return. So it's not kind of you're seen, go home, don't come back again. They're given very clear criteria of when they need to come back in and seek treatment and not feel dismissed because they weren't admitted.
Absolutely, great.
Fantastic. Thank you for both those responses. The other question that's being asked, Felicia, around the testing location at San Leandro Hospital, how are you determining, I know right now it's a pilot, so this will help us inform the question, I think, down the road, but how are we determining the staffing required for the testing site?
Oh yeah, great. Great question. So initially, you can see we have lots of folks in support out here today. We had an even larger group this morning, representative of leadership from many disciplines. However, the base staffing for the initial expected volume are 3 people. So we'll have 1 eligibility clerk, that's Leticia today. We will have 1 phlebotomist. That is somebody who's going to really be releasing the order and will be the one collecting or getting the specimen and taking that to the lab. And then we have an RN who's doing the nasopharyngeal swab. So we expect at our current volume that we will keep that level of staffing. As we can always scale up if that's not enough as we get busier. However, while we didn't yet have our cell phone out to time the entire cycle time, our estimate on the first 3 patients that we had was likely 10 minutes or less. We'll get faster as we get better. So I have a sense we'll be able to move through quite a number of patients with this current level of staffing.
Great. All right. So Janet, I know we've talked about restoration, and I think one of the questions come to utilization of supplies, and also as that relates to sort of masking. So I know that some folks have been using their mask for a longer period of time, some less so, some more so. Moving forward, as we think about the utilization of masks, as we're sort of coming out of what we sort of at least anticipated were the initial surge, do you anticipate any new guidelines related to the utilization of masks moving forward, or any guidance you might give the staff right now about how long they might want to use masks, or which kinds of masks they should be using, or just bringing from home, or those sorts of things?
Yeah, thanks, Terry. I think it's the status quo right now. We're not really changing anything. Having said that, we, I think, have all been wearing a mask for a week and then trading it in. I want staff to feel comfortable that they are advised to use the appropriate PPE for the appropriate use. And so not everybody needs an N95 or a PAPR at any given time. Also, it's a recommendation that you use a mask for a week if you're not using it for direct patient care. And so certainly if your mask is soiled or you're uncomfortable wearing it again after a number of days, make the request and ask for another mask, and nobody's going to push back on that. And so, I share people's concerns that this is going into week 2 and I'm still using the same mask. Just make sure you get yourself a mask. We're not advocating that everybody change masks every day. But certainly, if it's soiled or you've been wearing it for a while, I understand people are worried about bacteria building up on their mask. Just ask for another mask and it'll be granted.
And Tanvir's not on the call, and I would normally probably toss this his way, but there's a question about what are we doing to maintain our survey readiness? We're doing a lot of transitions, we're responding to COVID-19, but we know that we had a recent survey and there's a lot of work and focus going into making sure that we're stepping up our game in some respects in that area. Can you speak to what we're doing, how are we making progress to ensure that we are have the right kind of environment and following the right kind of protocols for delivering quality care?
Absolutely. So first of all, I want to just give a shout out to everybody and thank the sites that were surveyed. Issues were identified, it seems like months and months ago, but they have done fantastic work at making the changes that were necessary, cleaning up the environment, repairing things. It looks amazing. And so I think when they do come back to survey, and we're thinking sometime mid-June, I think they'll be blown away with how much work has been done and how much the staff have engaged in that process. The other pieces, even though we've had COVID, we certainly have not taken our eye off the ball, and we've been juggling kind of both priorities. Another big shout out to our regulatory department with Darshan and Nilda and her team. They have been rounding at hospitals every week. They take pictures, they create these PowerPoints that visually show us the improvements, the sustained improvements, and then what still needs to be worked on. The needs to be worked on is getting smaller and smaller, and the sustained improvement slides are getting larger and larger. And so we wouldn't have been able to keep the focus on if we didn't have this team rounding every week to make sure that we kept our eye on the ball. There are also weekly audits that are handed in by each department that committed to a certain change for the plan of correction, and so those are being monitored. Everybody is still focused on that work. And I think certainly any area that had a deficit that would potentially impact patient care, we made a lot of changes immediately to make sure that we continue to keep our patients safe. So as we ramp back up to open the OR, for example, open GI with scopes, we've made significant changes in terms of how we process our scopes, how we keep our OR safe, how we follow processes and procedures. So not to become cocky ahead of time, but I think we are well positioned to go through a survey if we continue to sustain the changes that we've made already. So really proud of all the teams that have engaged.
Yeah, and I would just add also is that there's so many leaders out there who are doing the regulatory readiness checklist every single day. And thank you so much for doing that. We really can see the difference that even amongst all of the work with COVID-19, there has been work in parallel on regulatory readiness and having our environment be ready in all ways. I see from the question, there was specifically a question around infection prevention and surgical services. Certainly when I've rounded back in the OR at Highland and here at San Leandro, huge shout out to SPD. Oh my gosh, it looks amazing in those areas, as well as our two OR leaders, Deborah Moole and then Karen Joyner. The area looks great, and even the the white glove test. I mean, it's amazing the change that we're seeing, and the also the camaraderie and teamwork of all the staff there, who are all just part of making that change. You can feel the difference, and I really appreciate that.
Yeah, staff in the PACU at San Leandro have actually said they're excited to come to work now because they've cleaned up their environment, and they did it themselves. We didn't do it for them, but it's exciting to come to an organized, environment that you know where everything is, and you don't worry about finding things. So again, kudos to everyone. It's been an amazing journey.
Sorry, I forgot I was on mute. I want to actually just chime in here just a little bit. So I really appreciate both what Janet and Felicia said, and where Felicia was ending with the collaboration, I want to echo. So we talk a lot about this dyad structure and this collaboration between our physician leaders and our administrative and clinical leaders, nursing and otherwise. And it's so core to our foundation of being able to address these opportunities. So definitely a lot of things around cleanliness and kind of things you can visually see, but also around processes. And so I want to just really lift up and express a great amount of thank you to our dyads with our physician leaders. I know in the perioperative space, just being able to kind of witness that myself and see with Dr. Victorino and Dr. Newmark and others really partnering with Deborah and the other nursing leaders in perioperative is happening in dental, is happening in a host of other areas, the emergency departments and otherwise. And so the last thing is happening amongst these two outstanding leaders we have on the call today too, both Felicia and Janet, who are really strong exemplars of what we're trying to achieve and supportive of what we're doing too. So I also want to add Janet's point, we're not out of the woods yet. In fact, I did a lot of calls this morning where I was asking people with the American Hospital Association and America's Essential Hospitals, hey, what are you guys hearing from the regulatory agencies? We know that they were putting things off until the end of May, not completely, but largely. And so as we get closer to that date, we are going to stay vigilant irrespective of when they come back to visit us, but we want to make sure that that is in fact the case and assure you all that there is. So thank you for everything you've done. Thank you for those partnerships, and thank you for staying vigilant, because as we ramp things back up, we have to hold our gains and continue to make the improvements.
Great. Thank you all for your comments and remarks. It's great to know that we are heading in the right direction relative to those issues. So particularly doing it given everything else we have going on. So kudos to everyone who's making that happen. I give a brief shout out to someone give a brief shout out to temps who were brought in to help with EVS. I don't know if that was you, Davecchio, they're mentioning in terms of a temp, but they said they're doing a great bang up job. So I know you've been doing some work there. So
no, they've been sending me through training, remedial training in some cases. I would append to that. I would thank them too, and I have been across our system. But let's also remember, and I know people mean this too, our existing EVS workforce is so vital and instrumental to the progress and the continued efforts that we have, and they are also doing an amazing job. All of them there across the board are so dedicated to our patients and to our staff, and it's just been great to collaborate with them and to lift up their work and the importance of their work, particularly during this time where we're looking at maintaining heightened awareness around infection prevention and cleanliness and safety. And so it's been an honor, actually. But let me just really echo that sentiment from whoever made the comment, both our existing EBS workforce and the additional help, temporary hands that we brought in to help them out as well, have all been wonderful.
Great, fantastic. As we transition or continue to move in different directions or one direction relative to managing the pandemic and restoring services, there's just questions about the practice of remote working, working from home. As an organization, how are we looking at that moving forward in the future? Any criteria may be testing that against? What message can we give to the staff about what that might look like in the future?
I'll chime in and I invite my colleagues to add to this. Regretfully, Tony can't join us today, but let me just say, as an organization, we've been calibrating our ability to support our response and preparation to the community and availability to the community with obviously concerns around employee safety and our ability to support our workforce to be able to support our community. So a host of considerations go into our ability to enforce and support various guidelines around social distancing, and the remote working is one element of that. So where we have been able to and have found the capability to sustain, at least in a short period, we responded very quickly. Some of these things are driven by an agreement that is not necessarily negotiated with labor unions, because we haven't been doing remote working a lot in the represented workforce. So we relaxed those things very quickly. We appreciated the union support in doing it. There are a couple of considerations that we have to revisit with respect to, again, the new norm, and looking at what those agreements look like, how we do them to support what may be some best practices that we've been able to garner from this to improve productivity, to improve engagement and work experience for a lot of our workforce, but be mindful of kind of their home situation and safety around records and patient information, HIPAA and things like that, workplace safety as well, and a host of other considerations. So as we ramp services back up, our guiding principle will be to try to leverage, not just from the clinical perspective, but from the operational perspective, what things have we learned during this that we can continue to build upon and extrapolate. And there may be some things where the nature of the work requires that we try to introduce people back into the work setting in a safe way, and we'll be considerate of how we do that. And then others where we may be able to either extend or even formalize on a more permanent basis, potentially, some of the remote working capabilities, subject again to some of the considerations we have to have with labor and other stakeholders. So nothing is etched in stone, and I appreciate, because I've heard from a lot of our workforce that variability is sometimes a bit frustrating for people, can sometimes feel like it's more capricious than actually driven by a set of principles that are in support of what I just articulated. But I want to ensure people that that my understanding is that in fact is that, and I am looking into that to see where there's opportunities where we may be able to do more or different utilization of anything that's at our disposal, including the remote workforce capability.
Thank you, Del Vecchio.
Sure.
I know that a lot of we know with social determinants of health, a lot of healthcare or wellness is driven by factors outside of our walls. One of the questions that's being asked is, and it comes up frequently, but what are we doing in terms of helping our homeless community who may be testing positive for COVID-19? And maybe Janet, I'll toss that in your direction if you could field that one.
Some help with this. So I think, we, on the daily calls when we had the command center, we would get a daily report out from Sheila Loiza and Population Health with Tangerine. There is a lot that's been done. I think, we see a number of these folks in the ED. They are tested. They're not necessarily symptomatic enough to be admitted, to go back to Dr. Tornavene's comments about acuity. But there are places that have been set up so that we can safely transition these patients, and they can continue to quarantine or be followed and then get their results back. And so, I can't speak to specifics, but there were a number of hotels that were stood up, and that we are able to, transition people safely and have them not have to go back to the street and then possibly become more ill and not be able to seek the treatment that they need. So coming from this, there may be some wonderful lessons that we learn about how to engage and really treat and manage our homeless population to keep them more healthy and not have to seek treatment so frequently in the ED. So I think there will be some good learnings that come from that.
Yeah, I think that's right, Janet. And so the county, through federal support and I think some local support, was able to stand up 2 different hotels, and they're actually looking to expand some of this throughout the county. But one, I forget the name. One was Operation Comfort, and the other was Safe something, I believe. But one was for COVID-19 positive patients who needed to continue to isolate or quarantine post their either ED visit or hospitalization and positive. And others were people who were not positive but were at risk of potentially being in a setting where they were exposed and maybe had some other baseline health conditions that might have contributed to that. So Safer Ground, that was called Operation Safer Ground. By the way, folks, she doesn't want to know it, but I tell you, but Tangerine keeps coming in to give me intel. So thank you, Tangerine. So those 2 settings are what we've been able to use to support our patients, not just homeless patients, but also individuals who may be housed, but the housing situation may not lend itself to being able to safely self-isolate and protect other members in the household. So that's been both the source of housing and other wraparound support. We've leveraged those spaces to provide other healthcare needs for individuals, but also social needs, so food and other sorts of things that people need. And so I want to give a shout out to Heather McDonald-Fine and Damon Francis from Healthcare at Home, or Healthcare for the Homeless, I should say, who have been helping to really support that effort. And we've been doing testing and other supports at that site too. Dr. Baden mentioned last week going out to really support some of their infectious prevention protocols and practices there, and soliciting some AHS staff who've been gracious enough to volunteer their time and expertise to support that work as well. So a lot of different efforts to do outreach to our homeless community during this time, and continued advocacy on our part and others, which the county supports in being able to continue to provide resources like this going forward, because they've been immensely helpful in helping with throughput and getting patients into appropriate clinical settings and or post clinical settings, and making sure that we retain our capacity for individuals who need to be in the hospital.
Great, thank you, Del Vecchio. We've done a lot of measures to help protect against the spread of COVID-19 within our facilities. Janet and Felicia, maybe you can respond to the question. It's one of the challenges with COVID-19 is, what are we doing or continue to do to, protect patients and staff, given that you can be asymptomatic but still be positive for coronavirus? What are the things that we continue to have in place to help try to address that situation?
Well, I think that the key item is what I'm doing right here, which is I have a mask on, and then performing hand hygiene. I mean, that is those measures are certainly key to help reduce the spread of asymptomatic shedding of the virus for people who are pre-symptomatic and who might have the virus. So the combination and the mask that I'm wearing is about my protecting everyone around me from my droplets. And so that's why we do universal masking.
Yeah, I think the other thing that we're doing is the daily temps of everybody that comes in to the facility. They're getting their temperatures done, and then there's some workaround. If you do have a temp, then you're advised to seek medical attention and possibly get a test from there. We continue to limit visitors that come in and out of the buildings. We've continued to ramp down on some of our services that would bring greater numbers of patients or people into the buildings. We've also done a lot of these kinds of meetings, Zoom meetings, where we're not having groups of people come into closed space. And then we've postponed Nurses Week and Hospital Week for that specific reason as well, so that we don't have large numbers and we will get back to business as usual. But I think there's been a lot of significant changes that have been made to keep people safe. So in addition to the mask and washing hands, the social distancing seems to be something that has really, reaped rewards in terms of not transmitting the disease.
Great, thank you for those responses. Felicia, the question being asked is, what sort of test is actually being used at the testing site in San Leandro?
So this is the RT-PCR. This is not the so-called rapid test. So as we are not using the rapid test for a few reasons. One of which is that its testing characteristics make it, it's not as sensitive as we need it to be in order to really provide the reliability for surveillance. And so because of that, we're using our gold standard test, the RT-PCR test, and it can come back in as soon as 24 hours to as much as a few days, depending on the capacity of the testing site with the Alameda County Public Health Lab or UCSF.
Sorry, I forgot I was on mute again. Can I add, Felicia, can you talk a little bit more about like that capacity piece in terms of the laboratory piece? I know we are continuing some efforts to expand our own ability to do more of the PCR-based testing in our system. So maybe you could share a little bit with the group around what we're doing in that space.
Yeah, and sorry, I don't have a lot of the details on what's going on inside the lab and in our ability to do internal testing yet. And I would, Dr. Ng, unfortunately, went back into her lab in order to provide the details about the analyzer and when that might be ready and stood up here at AHS. However, we do not have any capacity issues outside of AHS in terms of our the specimens that we're sending out. So I'm sorry, I'm not up to the minute on that.
Oh no, that's all good. I was hoping we would have one of these hot moments where we could just pull her over.
Could just pull in.
So messed up on the timing there. But yeah, my understanding is similar to yours in that we're still a couple of weeks out from our ability to bring it.
Exactly.
Still have great capacity right now, so that's not an issue.
Right.
But to the response that you gave earlier, when we
she's
bring
coming.
it, she's coming.
She's coming. Yeah.
She can provide this better than I can.
Yeah.
Hey, Dr. Ng.
Here, come in. I'll...
That's a true cameo. I like that.
Yeah.
Hey, I was wondering if you might share with the organization more about your continued efforts to bring PCR testing in-house and how you're feeling where we are in that process.
Thank you for asking. It's a great question. We have the instrument capable of providing testing. The manufacturer has looked at the reagents they just developed. The reagents are with the FDA for approval. Once they are approved, we should be able to get the reagents and then provide testing in-house. Our testing platform is a high throughput, something like 500 to 1,000 tests a day, something like an hour or less turnaround time. And so we have been bugging everyone, the FDA, the state, the feds, and our manufacturer to get those reagents in. The target date is early June. We're trying to get that earlier.
All right. Thank you, Dr. Ng, and thank you for everything you're doing. But that is just amazing, and we really are excited about it. We know with you on the case, we have our best shot. So thank you.
Thank you. Go back.
There's serendipitous.
That was well done. Well done.
All right. So the beauty of live television. So we are at the hour. We have about less than a minute left. Delvecchio, I will turn it over to you. I want to just real quickly, this is still Nurses Week and we're blending into Hospital Week. Just a reminder that there are a number of videos and tributes to thank you all for all the work that you're doing. Please make sure and visit our intranet page to take a look at those things. We really want you to know how much we appreciate you. So make sure to take a look at that. Also, reminder that this video will be posted onto the intranet. So if you want to revisit it or if others have not had an opportunity to see it firsthand, please let them know that they can go to the COVID-19 resource page into our intranet to actually access the information. So with that, Del Vecchio, we'll turn it over to you for the last word.
Okay, 2 quick points. So thank you to everybody. I want to really quickly, as we transition to Command Center, these wonderful memos that went out every single day and that are still coming out, as well as this conference is brought to us really by Terry's outstanding team in PACE. And those memos are beautiful and very helpful and very well received. They don't write themselves. And so Luis and Victoria and the entire team, thank you so much for everything you have done and continue to do. You've just been outstanding. That last thing is every week I like to say to people a reminder for self-care and wellness. So let me remind you, take care of yourselves, take care of one another. Be kind and understanding. Know that we're doing these Wellness Wednesday messages, minor messages that are just designed to really reinforce that. Today's message is about practicing mindfulness and taking time to be in the moment. And there's actually a link on our to a mindfulness couch that you can use to relax and center for free. And so please be sure to take advantage of that. And with that, thank you all so much. Thank you to my colleagues as always on the call, and I will see you next time. Bye-bye.